Well, this week, CBS 13 investigates kids in crisis. We're digging deep into the mental health crisis impacting our children.
CBS 13 anchor Tony Lopez is here with the first part of our investigation on this. Tony.
Yeah, such a huge problem for so many families. Medical experts are sounding the alarm on a growing number of young children experiencing high levels of stress. To make matters worse, there's a nationwide shortage of therapists. So how are communities dealing with this dilemma? For some answers, we turn to two local experts and two young adults who've witnessed it firsthand.
I say for parents out there, I say just to listen to your kid because you don't know what's going on.
18-year-old Allende is speaking from the heart and experience. The student from Natomas used to run with the wrong crowd. The misbehaving escalated to serious charges for him.
It was vandalism and trespassing. So yeah, I was on probation for 6 months.
Allende spent 3 years in a juvenile justice program and was discharged a few months ago. Then there's 18-year-old Jamea from Rancho Cordova. At a young age, she experienced family trauma and became homeless at 12. Both of their cases were referred to Stanford Sierra Youth and Families, one of the largest nonprofit agencies that provides mental health services in Northern California. Dr. Laura Heinz runs the facility.
We serve approximately 2,500 children a year, but what we touch is about 6,500 youth and families.
And with a high demand for mental health support, agencies that provide those services can't seem to fill open positions.
We are finding a constant shortage of therapists.
I used to say before the pandemic, we have a workforce shortage. We now have a workforce crisis.
Dr. Ryan Quist is the behavioral health director in Sacramento County. He tells us he finds it hard to compete with other employers.
Our services, we serve the more seriously mentally ill folks, and we have to do that in person.
According to county health rankings and roadmaps, in 2021, there was one mental health provider for every 240 people in Sacramento County. At Stanford Sierra Youth and Families, their therapist-to-youth ratio averages 1 to 25. They're also dealing with staff shortages. Currently, there are 36 openings. It's a far cry from the nearly 70 open positions last November. So what's working for Dr. Heinz? Therapists at her agency can telehealth with patients, something the county health department simply can't do. Dr. Heinz also offers her staff self-care services. But the key to her overall success is working with the entire family. We wondered, can the accomplishments at Stanford Sierra Youth and Families work in other parts of the country?
Our hope is to really replicate the work of the family and youth voice at the center, but across the nation.
Jamea and Allende are two success stories. Jamea recently graduated from Walnut Wood High School in Rancho Cordova, and Allende from Pacific Career and Technology in North Highlands. Both are paying it forward by volunteering at Stanford Sierra Youth and Families.
I don't owe it, but they deserve it, because I came from that and I know how it feels.
How did I get through that? I don't know.
Jamea now has housing and is looking for a place of her own. When we asked what advice she'd give herself as that young 12-year-old child,
I would start off by telling her I'm very proud of her. I would advise her to keep her head up.
if you or someone you know is in crisis, get help from the Suicide and Crisis Lifeline by calling or texting 988. We also have other resources on our website at cbs13.com. Also this Wednesday, we're bringing you a powerful documentary called Connecting the Dots. In this film, you'll hear from young people from around the world about their struggles with mental health. We'll be streaming this exclusive film live at 6:30 p.m. on our website, cbs13.com.
All right, Tony, thank you.